My name is Dr. Karen Herbst, and I work for Total Lipedema Care, and I am an expert in different fat diseases, including lipedema and Dercum's disease. And I'm here with my patient, Kathryn Kates, and she has a very rare disease called Dercum's disease, spelled Dercum''S. And Dercum's disease has a few different types, and one of the rarest types is the one with Angiolypomas, and that's what Kathryn has. And Angiolypomas are very painful lipomas. They're not even considered by some to be lipomas. They're considered to be vascular malformations, and they are known to be very painful. And right now there is no cure or no concrete treatment for Angiolypomas to reduce them. And so we tend to send our patients like Kathryn to have surgery. And unfortunately, surgery generates more inflammation and they can actually grow again after the surgery. So it's kind of one surgery after another. And more research needs to be done in this area to find non-invasive treatments. But with that all said, Dercum's disease is a very disabling disease. It is so painful that people like Kathryn have trouble sleeping at night. And if they don't sleep chronically, we all know that wreaks havoc on the system, metabolically especially, and that puts them at risk for type 2 diabetes, cardiovascular disease, and other metabolic diseases. A lot of people with Dercum's disease have trouble doing their activities of daily living. Just getting up is difficult. Eating causes pain in the body. They can't exercise for long. They have problems with every system of the body. This is a systemic disease. So they have cognitive changes. They have cardiovascular problems such as tachycardia or even a slow heart rate. They can have trouble breathing. They have gastrointestinal problems. They can end up with kidney disease and many other signs and symptoms, and these have been published in the literature. So what I'm here today to say to you is that Kathryn is my patient. She has a very rare, disabling, painful disease called Dercum's disease with Angiolypomas, and I'm asking for your help for her to get her the care that she needs. It's what we need to do in order to help her live a fuller life, because she has done everything I have asked her, and we're continuing to try new things, but she is still in a very severe state and she's struggling. And I work here in the United States. She lives in Canada. If we could have some sort of cooperation and assistance from the government, that would be optimal.
Yes, and help for paying out of province, all the expenses that I've had to pay for the surgeries and things.
Yeah, there's no expert in Canada right now that can help Kathryn, especially with surgery. You have to kind of be aware of how to remove these lipomas. So she's come to the States and she's paying out of pocket, and for us it just makes so much more sense for her to have her care where she lives in Canada. And what can we do to make that happen? How can you work with us? How can we work with you?
Thank you so much, Doctor. You've been absolutely fabulous to me, and you know, I mean, I'm so sorry.
I'm sorry. No, I'm sorry that you have to go through this and that you're not getting the care that you need.
I'm not.
So we need to change that.
And I've looked for 10
Please
years.
help.
Thank you very much.
Mm-hmm.